Welcome, everyone. Welcome to Cyber Lunch. And I am Grace Giraldo. I'm the director of the Cyber Defense and Information Security, Information Assurance Professional Science Masters. It's a master's program that operates with the intent of bridging industry and academia through different activities that are industry aligned. Today, you have joined us as a guest in Cyber Lunch. And before we get started, I want to just quickly say thank you to my board members that are in attendance. So I know we have Scott Levon from Clone Systems, Grace Wachovia from TD Bank, Carmelia Henry, which is one of our panelists today, and Steve will be introducing them properly in a sec. Derek Fisher from InvestNet, Javier Suarez from the Greater Philadelphia Hispanic Chamber of Commerce, Vana Kurana from Vanguard, Colin Congo from the FBI, and Robert Hanley from Cyber Solutions and Engineering.
Well, thank you, Grace, and great to see everyone. I'm Steve Nappy, Associate Vice President for Technology Commercialization and Business Development. And essentially what that means is we're sitting at that intersection of university and industry collaboration that Grace touched on, specifically for technology development. So I sit within the research arm of the university, which at Temple conducts over $280 million of research annually. That produces about 400 discoveries over the past 5 years, and we've had about 25 active businesses that have spun out to advance new technologies. These spin-out companies serve as vehicles to bring Temple technology to market while contributing to our local economy and bringing additional support to our R&D efforts here at the university. Today, we're pleased to briefly highlight one of the businesses that has served as a long-standing partner for Temple University, starting with the help of Pennsylvania grant funding and other support. New technology was developed by Dr. Gerard Kreiner in the School of Medicine, primarily looking at remotely monitoring patients with chronic obstructive pulmonary disorder. That led to a partnership between Temple and HGE Health to further develop and bring new remote management solutions to patients. I'm pleased to introduce Dr. Michael Marcus, CEO of HGE, to give a snapshot of that path to market. Mike, I do recall some of our initial discussions, this dating now back 10 years ago, sitting with you in front of a PowerPoint discussing that path forward and what that might look like. We'd love for you to give us a glimpse of that path forward with the timing challenge in this particular Zoom of compressing that 10-year span into about a few minutes. So I'll kick it off and stop there. But you're used to that, right, as an entrepreneur?
That's right. You know, time, money, don't have a lot of, gotta work quickly. No, I appreciate the opportunity to talk. Yeah, very quickly. So the original story was I was asked to come to Dr. Kreiner's office for him to talk about his research. I sat for a few minutes as he talked about the funding he received from the state to do remote monitoring of patients with COPD. He was just completing a 2-year prospective randomized trial, had some amazing results. And as I was sitting there talking to this, very passionate clinician, I thought to myself, wow, this technology and the ability for patients with, that can't breathe, right? That immediately need help. They can only either go to the ED, often be admitted into the hospital, but can you provide an intervention outside the 4 walls of the hospital, but do it on a large scale? That seemed like a very big idea, something that would be very important to patients and the overall community. So I called up Steve and I said, hey, you've got a big idea with a great researcher and I want to commercialize it. That was the initial. The next stage, of course, is to work with the university. It's been a great partnership, I have to say, with Steve and Todd. And I'll say this thing about commercialization. It is, finding people with big ideas that they're passionate about, and you got plenty of researchers who are passionate about their research. Then you got to find people, entrepreneurs who are passionate about that idea. And the idea, if it has real validity, it's going to make a very large impact. The problem is taking something, as they say, from bench to bedside involves time and money, and ultimately it's risk. So I've been the CEO of this project for the last 8 to 9 years, and I'm not a smart guy. My only job really is to talk about the idea and raise money and never run out of money to keep the idea going. And that's really the journey of taking technology. And really, when you talk to people about bringing it to the patient bedside, it's about de-risking everything. So you have to de-risk, have good clinical foundation on the research. That you de-risk it. You talk about how do you build a product, in our case, a product and a service that people will pay for. You got to de-risk it. And then we think about this particular technology we bring to market, monitoring patients outside the hospital. How do you de-risk, the data and the security around that, right? So cybersecurity is a huge component of de-risking and providing, how do you bring that great patient care and great solution to the world market? And, that's an important component of it. So those are the three things, really. You got to be passionate. You've got to never run out of money, and you've got to de-risk it and get it to that patient as quickly as possible because they need it. So
thanks,
that's
Mike.
my 10 years.
Terrific. We appreciate it, Mike. And as we confront new challenges, the challenges of today, we thought that would be an important window into what that journey looks like to help set up the next conversation that Mike's going to join us in. So to transition to the panel, we are going to look at that intersection between healthcare and cyber initiatives and have Mike join our panelists today, including Carmelia Henry, Temple University professor and advisor to the Cyber DIA program, as Grace mentioned earlier. Duncan Hollis with Temple University's School of Law. Dr. Gordon Morwood with Temple University School of Medicine. And I will go ahead and pass the baton back to Grace to go ahead and get this panel started.
Excellent. Excellent. So I want to say first, thank you for everyone for joining us. Let me stop this, and I want to give the panelists an opportunity to say hello, quick blurb about themselves if they wish, but also once the introductions are done, let's start with the discussion. Let's start talking about cyber incidents in the healthcare industry and other topics, right? Duncan is a specialist in law. He's going to bring law, audit and compliance, and regulatory other things. Carmelia, I would love to hear a dynamic discussion happening. You don't have to wait for me to ask questions. So let me start with Carmelia, ladies first. Say hi, and then we'll get started with hellos from all the panelists and move on.
Hello, good afternoon, everyone. I am Carmelia Henry, and I have an extensive background in risk management, technology, healthcare, finance, you name it. I probably have crossed some bridges. So excited to be here. Thank you, Grace, for having me. And I think it's going to be great because we're going to be doing the same thing with our, DIA, our program here with audit and compliance and bridging that gap with the assessments in the industry. So it's going to be fun.
I get started since I started and had, as everyone does, you have to have one of these with somebody forgets to turn off the mute button. So I have now done so. I'm Duncan Hollis. I teach, I'm primarily an international lawyer. So I work on international law issues. And over the last decade plus, I've focused on issues of cybersecurity at the global level. So primarily looking at state operations, what sort of, think SolarWinds, if you're looking for a recent example, and kind of working on what are the rules of the road, what things should states and their proxies not do in cyberspace, what should they do? And with COVID-19, that's obviously had a lot of tie-ins to healthcare over the last 10 months. If I get a chance, I'll talk about some work I've done with Oxford. And I should also just disclose that I'm a regular consultant for Brad Smith, who's the president of Microsoft, and his digital diplomacy team. So, but I'm speaking in my own personal capacity today.
Thank you. Dr. Moore?
So I'm Gordon Morwood. I'm a clinical anesthesiologist. I've been in practice for about 25 years. I currently serve as the chair of the Department of Anesthesiology at Temple University. I should probably preface my contributions today by saying that I have no expertise in technological or security matters whatsoever. I am, in fact, the guy that uses the same password for all of my accounts. I'm sorry if I'm offending anybody. But I think my position here today is to try and provide some clinical and real world context to some of the subjects we're going to be discussing, because I think cybersecurity and reforming the healthcare system is an important topic. But much like anything else, if you don't understand the actualities on the ground that the people are dealing with, you're destined to meet a lot of failure up front. So I'm going to try and keep the conversation grounded in reality.
Excellent, excellent. And Mike, we heard from you, but might as well hear from you again.
I appreciate it. So I'll follow Gordon's lead and say I'll try to take a very grounded, practical approach to cybersecurity and taking a technology, obviously, from a research institution to market. I think I raised my first capital for this project from my mom and dad, right? And so I couldn't really afford a lot of security infrastructure as we were kind of getting things off the ground. So I'll talk a little bit about the trade-offs of, taking a technology from startup phase, to the commercial phase. I will say, I'm finally able to say we were recently purchased by Vapotherm, a publicly traded respiratory company, about 30 days ago. And it's really nice to have additional resources around this topic. So
let's get right on with the discussion. Can you guys start by sharing some kind of incident, some kind of what do we need to bring up to the attention of cyber when it comes to healthcare and healthcare related issues?
Sure, I'll jump in here and try and answer that question. So I think the first thing that you need to understand as you're looking at security and healthcare and information technology are the challenges that you're going to face with the people and the organizations that you're going to meet. And I think there's two important concepts here to understand that probably are not obvious to most of the people in this audience. The first is the infancy of information technology and healthcare. We are really at the very beginning of this process. When we were discussing this in preparation for this panel the other day, I made a couple of people laugh by saying we are essentially sitting around a campfire banging rocks together, trying to make technology work in healthcare. It's not an exaggeration to say 10 years ago, easily half of the healthcare systems in this country were still conducting all of their record keeping on paper charts. And so we have now progressed. I think most major healthcare systems have electronic medical records in place, but understand that those are simply information gathering tools. We are awash in information, but we have very little data. We as an industry don't yet know how to make use of the data that is being archived. And so when you talk to people in healthcare, things that are second nature to, I think, people that work in information science, data science in other large industries will be shocked at how primitive we are. So that's take home point number one. Take home point number two would be to understand what's happening in healthcare right now. We're undergoing massive reformation of how the clinical systems work. We are facing much more production pressure than we used to. The profit margins have become much narrower. So to keep our hospitals running, we have to be much more efficient with our patient throughput and the way we execute procedures. We are delivering much more of our healthcare in a patient-centric manner, which means that instead of us sitting somewhere and having patients come to us, we have to go to where they are, and wherever they are in the hospital, whether they're at home, and we are expected to communicate with them asynchronously across a variety of different platforms, email, text message, et cetera, not just phone calls. And finally, we're expected to collaborate with each other in a much more seamless 24-hour fashion. So I should be able to exchange information easily with a cardiologist up in Lehigh Valley on Sunday night at 10 o'clock when I'm caring for a patient who's arrived in our emergency department. And so the flow of information and the pressures that we're under to provide seamless care to these very complex patients really push us into new realms in terms of how quickly and easily we exchange information. But that, of course, I think flies in the face often of truly having secure systems. And we find that a lot of times as security ramps up, it becomes a barrier to appropriate care and sometimes even to safe patient care. So don't be shocked if you come in as the cybersecurity consultant to a clinical area and introduce yourself. Don't have big smiles on their face because they're going to look at you and think, "Oh my God, you're here to make my life more difficult." So that's my take on the barriers that you're going to face.
Yeah, I think like if I can ping off that, I think like from a more system-wide perspective, not the individual practitioner, right? The digitization of the medical profession, I think has created more more opportunities for threats to arise. And and let's be clear that when we're in the healthcare sector, we're talking about human lives at stake. And so, this past year, some people on this call may have seen the news, right? You have the first reported death from ransomware, right? So in Dusseldorf, some ransomware locked down an emergency room and they were unable to function. So they, put the word out like, we can't take any new incoming patients. And a woman who was en route to that hospital is rerouted to another hospital that's 20 additional minutes away. And she, and that 20 minutes proved critical and she ends up dying. And the Dusseldorf police are treating it as a homicide and are pursuing the hackers who, by the way, most likely were not in Germany, right? Like almost so much of this stuff is international in nature, and you don't tend to hack in your own backyard. And so, that I think is the consequence here on a very individual level, but also, with stories of either Russia or China or their proxies targeting vaccine research, acquiring phase 3 clinical trial results and then modifying those results and putting them out on the dark web and the like, that you can have other less direct, but no less profound implications for human health in the midst of a global pandemic.
I can add a perspective as well. So, our primary work is, developing, technologies and services for patients in the home. So as you can imagine, there's a lot of sensors and a lot of data that's coming from medical devices that are associated with a particular patient in the home, as well as us communicating with that patient directly. When we assume that things aren't secure, we follow every known protocol to establish security around that patient and that experience, assuming that we will fail. And then all the mitigation associated with, okay, when those events happen, how do we, so it's constantly conducting risk mitigation all the time. It's just part of the overall business, because to the point of people are making clinical decisions around a patient that has a complex condition. And so it's just a big part of our overall approach, just as reimbursement or other factors associated with running a business. So in healthcare, not having a team, infrastructure, protocols, and being in constant risk mitigation is it's not tenable. So that's just a big part of how we approach things and how you have to.
How is that affecting compliance and the ability to maintain compliance?
So I'll take that one. Basically, it's a very huge, complex scenario, right? Obviously, in the Medicare space, we have to be very careful because it's arguably the most difficult area to manage, both digital as well as the cybersecurity implications that could present itself. And that's why it's very important to have a very robust, secure network environment to mitigate some of those layers of intrusion. But more importantly, to the health of the patient, to us as consumers, as individuals that may be participatory in a medical situation. So malpractice is also a factor, right? Because when you get down to it, that particular patient that was presented, right, it can come back into another scenario. Oh, so yes, somebody compromised the environment and hacked into it. But at the same token, there's the compliance and then the follow through that has to happen. So doing things up front, getting ahead of that, being proactive, albeit challenging in the health arena, is probably the best approach to address that. So from the industry perspective, when you think of medical records, this is a very, I would say, a very keen area. If you break everything down into a data component, this is an area where most of the hackers love to permeate, right? And they're very clever into trying to present themselves that they're someone of a legitimate nature. So as healthcare and technical and fintech and health tech, we have to be very clever as well. We have to get ahead of that. So we need to kind of target what these cyber criminals are looking at. And we shouldn't be afraid of digitizing our data because it does make it better. You don't want to lose records that are in paper form, but you also have to kind of think about all the various facets. And there are probably 5 to 6 key areas that really need to be honed in.
There are different challenges that I'm hearing here. Let's start with the expectation that the customers have of service of the medical professionals. This rush to, to be on 24/7, but yet there's laws that need to be followed. There's compliance that needs to be followed. And if we're always in a rush, how can we also like sit back and preempt some of these things like you're saying? You're saying, let's tackle some of this risk ahead of time. But as an industry, it's just going so quickly. What is that balance? What is the balance in your experience, Dr. Moore, but also from an industry perspective? We have different stakeholders here that need to be working together. What is your take?
Because I'm not sure I have the answer to that question, but I'd like to flesh out the problem a little bit further. I mean, when you look at if you look at something like a Goldman Sachs or a Verizon, you have an entity there that the boundaries are controllable and you know where the information is supposed to be and where it's not. But as a healthcare system, Temple University healthcare system, we service 500,000 patients a year. And it's a varying pool of patients that come in and out of our responsibility over the course of a given year. And those patients have a variety of outside physicians that have to interact with our healthcare system. And the flow of information is expected to be relatively seamless now. And so as you're getting more and more home-based devices, data that comes not only from within our own labs and our own medical records, but data that's supposed to be fed into us from external to the organization, having that be secure, the flow of information in and out of the system from all these different entities, not all of whom are aligned with the healthcare system, and figuring out who's friendly and who's not is extremely complicated. And there are regulations in place around what platforms we can use for telehealth and things like that. My guess is, not being particularly knowledgeable in this particular area, I suspect that those regulations, you could fly a jumbo jet through them in terms of finding loopholes that hackers could easily access if they are determined to.
Thoughts from the panelists?
I mean, I think one of the challenges here, is both the threats are diverse and the threat actors are diverse. And so, one of the things we've constantly seen, again, looking at it from kind of a more global perspective is how do we allocate responsibility among, say, from the hospital to the, in our case, the Commonwealth, to the federal, to kind of the global level. And some of you may recall back in 2017, North Korea released this WannaCry ransomware, which took the national health system in the United Kingdom by surprise. And, a lot of their medical devices were rendered inoperable until such time as they could, clear the ransomware. And that obviously has real, again, health implications. But then there followed this real debate about, there was a patch that had been made available before the ransomware was launched. And what was the obligation of the national healthcare system, or here in the US, what would be the obligation of the hospital to have done that patch? Versus, was this something, hey, this is another government that's launching this, it should be the government at the federal level, or even, the NSA is who the defender should be here. And this shouldn't be the job of every, medical system or every, hospital or community of hospitals to engage in defending this. And frankly, that's a conversation we're still trying to have, is trying to decide, what is it we're expecting at the kind of micro level, individual, like Michael said earlier, like when you come in as the CISO for a health system or for, a hospital network, like what is your responsibilities, and what are the things that you might be found professionally liable for failing to do, versus what are the things are we really going to expect you to keep the Russians out of your system versus the proverbial teenager in their parents' basement. And so I think that's again, like Dr. Morwood, I don't know that I got an answer to that, but that's been a dialogue that's been ongoing, and we need to have to try and sort out where responsibility lies, because then we can allocate resources accordingly.
And I'll have a comment here as well, where looking at it purely from a commercialization standpoint, I'm trying to convince Gordon that my product, my technology is better than everyone else's, because we're creating, we're proactively innovating around security, and at the same time working closely with federal, state, around making sure what are our best practices. But I think it's important to us as a company to differentiate ourselves by saying that's the innovation component, taking the threat as real and it will happen, but we have to innovate and stay ahead, right? And looking at it from that perspective to differentiate ourselves from the rest of the market and solve those problems.
What about things like mitigating controls to some of these risks, right? So when the ransomware attack happened at the hospital, should that hospital had like a risk mitigation procedure to follow in case their systems were not available? How is it that, and I had this discussion in the classroom, how is it that we stop being a hospital, and how is it that we stop attending patients? And I'm sure there's risk from a clinician point of view, but I don't think the answer is we go back to paper, but shouldn't there be a plan? Is there a plan?
I mean, just from a clinical standpoint, I could tell you we have downtime procedures for all of our information technology systems where when the technology is not available, we have ways of documenting our care on paper. That's what's available to us. But that, unfortunately, that doesn't replace the store of information. If the attack is such that you're locked out of your information system, if you look on any given day, the number of patients that we have in hospital and the number of critical data points that have accumulated just over the last 24 hours, lab values, drug dosages, last timing of drug administrations, things like that. If you lock those down without any notification, there's almost no way you can overcome that. Now, all of a sudden, as the nurse at the bedside, you don't remember, you don't know when the last time they got this drug or that drug or what their last lab value was. And it's a terrifying feeling as a clinician. It's like you're flying in a plane and all of a sudden everybody covers up all the windows and takes away all your instruments. You have no idea where you are or where you're going. It certainly, I agree that there should be risk mitigation. I don't know how you would mitigate that other than backing up your entire system continuously, which I don't know if it's practical.
While I'm saying that's one end of the spectrum, the other end is we give too much freedom, meaning maybe the clinicians have data backed up in a portable drive, which it also comes with its inherited risk, right? We can't all have a copy of all this data because I can lose it in the parking lot. Next thing you know, we have the USBs in the parking lot, right? And people are picking it up. So where can you speculate is that middle ground? Any ideas, Carmelia or any of the panelists, right? What's that middle ground look like? From a risk mitigation.
Right. I think from a risk mitigation perspective, the first and foremost thing that any healthcare medical institution really needs to do is to really understand their environment and do some preliminary assessments, right? To be blunt and honest, unless there are regulatory, and I don't mean that Big Brother needs to come into every private and public hospital, but unless there's some kind of baseline regulatory approach and throughput, where somebody can press a button and say, hey, I need this trigger and alert to happen. What the onus is, and particularly in private and medical institutions, is they're basically hiring their own risk management team. They're hiring ethical hackers. People can do vulnerability and penetration testing to do and validate and ensure that their medical devices are being properly protected. That's a major and extreme, right? But as a business, it makes sense, right? as an entity, as maybe a small community hospital, which may not be able to afford that, then they're in the same kind of boat as maybe private practice. I've, persons that have multiple private practices, and this is a huge factor for them. So the middle ground, I think, is, understand your environment, understand where you may have some risks, do some assessments, get someone externally to come in and do an assessment of your environment and help you, mitigate some of those risks. That's probably the middle ground.
Yeah, I think just to chime in, I mean, one of the other things thinking about regulatory risk, in healthcare, the risks, the mitigation strategies are a little bit different than in other areas, in other industries, right? Because like right now we're seeing a lot of talk about cyber insurance, right? And cyber insurance is like how, if you're just in the business of whatever your business is and your business makes money, like, and you're dealing in data and that data gets compromised, in theory, if you get cyber insurance, you can make up for your losses. And certainly cyber insurance can help with hospitals and the like, but at the same time, like, I don't really like the idea that we monetize losses of life or real degradations of patient care, like the sorts of things we were just talking about. And so in some ways, like the potential cyber insurance has to help mitigate cyber risks, across industries is less attractive, as less a silver bullet solution for the healthcare industry. And that, I think, explains why we end up back in the, particularly for larger scale enterprises, having to do pen testing and bringing in, red teams and the like to try and stay as on top of everything as you can. And I do think there's, some move to the cloud in the hope that, that can also mitigate ransomware and, put your faith in, the Amazons, the Googles, and their defenses. But still, they're, a persistent and sophisticated hacker is going to get at you if they want at some point. That's the reality.
Yes, absolutely true. And I just want to make a clarifying point. When I'm speaking of like the assessments and what have you, I'm definitely not even thinking about cyber insurance. Cyber insurance is a given. That just protects you on the back, and that's a reaction to the real crux of what needs to happen. What I'm really referring to is actually getting an assessment done and looking at your environment. For example, I personally and professionally have looked at multiple mid-level practices and looked at some of their, their HIPAA, with the way they're storing their data, helping them mitigate, put additional layers in between where that potential penetration and exposure can transpire, are probably some really good proactive steps. And then I also would like to echo that, you can't solve everything, right? You have to look at what can you do that 20 to 30% to get that 80% benefit that's not going to get you compromised in those cases. And we all recognize that there's a monetary factor that's associated with a lot of these institutions trying to do this. But then my technologist hat comes on and I say, if you're going to dabble in technology, you need to cover yourself in all aspects of that technology. And so focusing on those components, I think, is also very, very helpful. So I have seen an uptick in trend. A lot of people reach out to me and they were talking about how they can improve their risk throughput in the medical space, and just giving, additional consulting factors in that. So I just think there's no one cookie cutter, to be honest. You really have to kind of peel back the onion layer.
Especially because it's in the healthcare, right? With Industry of Things. We're talking about a broad spectrum of technology controls to be able to assist and support the regulatory and compliance. It seems like every device that it's modern, right, with the IP, is now putting the hospitals and the patients and the doctors at risk. So now there's more attack points and wow. So just off the top of your head, and that doesn't have to be an extensible list, what are some just the basic technology controls that could potentially help? And understanding that technology controls are just one part. We also have the people controls and the policies and things like that. Some ideas?
I would say data management is very critical right now. Manage your data. It's probably top of the list. Access to that data, access administration, how you manage your access to your key points. And then I would say secondary to that would be physical security. So wherever your stuff is housed, if it's physically housed, make sure your access controls, how they're granted, permissioned in that space, are secure, so that people can't physically come in and get close to your servers. They literally have to get in from externally. So those are probably some high level for.
I would add policies and procedures for the staff. Obviously physical data security, but not having your staff up to speed on the potential threats and how they play their role in that, and also consequences for not following procedures, right? I mean, lots of issues that we've experienced, and many of the security breaches that have happened in a very public way, right? It's because people just aren't following procedures. So that's a huge factor, I think, should be at the top of the list.
So if the people not following procedures, it's like a repeating reason. There's a repeating reason why people are not following the procedures. Some of it is need. A lot of people would say that I need to get my job done, right? And think about the ratio of healthcare providers versus customers versus the patients. And suddenly I would be overwhelmed that you have to attend to so many people, and the resources are much smaller in numbers. They need to get their job done. So I don't know if there's and there probably is, right? Some basics that if you're using portable devices, there's like a hard drive, a laptop, it should be encrypted. How feasible is that for you, Dr. Morwood?
Thanks for commenting, Grace, because I was just about to put on my realist hat and say, well, hold on a sec. Because to Carmela's point, I completely understand what she's saying in terms of those are that's the basic way you approach security. Control your access points, control your physical plant, make sure that people and they're logging in and out. I can tell you that every one of our clinicians, and when I say that, I mean like every one of our nurses and our physicians in Temple Hospital has to uniquely access an information point, a unique computer, whatnot, probably a couple 100 times a day in the course of and when I'm saying a unique access, I mean, you went from one computer to the next computer, now you're at another computer down the hall. So you don't have one desktop computer that you're logging on and logging off. You are repeatedly interacting with a device for maybe 60 seconds, and then you're gone. And then the next time you interact, it's another device. And you do that hundreds of times a day. And this would just give you all chest pain, I'm sure. We have mobile computing stations throughout the hospital on wheels. They go everywhere. And they're clustered in corners, and people are coming in and out, and patients' families are coming in and out, and patients are coming in and out. And so you have computers just everywhere with secure access. Now you have to log on, of course, but if you're talking about physical or sort of traditional security protocols, I invite you all to spend a day in the hospital. I'm not saying what we're doing is right, but I'm just saying to get the job, to your point, to get the job done, a lot of those traditional concepts around security are just unworkable, or at least very cumbersome.
It's actually a very interesting invitation, because sometimes we learn from those experiences, right? That while we have the concepts and our principles about security and how to do it, somehow we have to scale that or adapt it to the practice. What are your thoughts on that? Is it even possible to do so?
I think one of the things just to tie in here, because a couple people have, so much of this comes down to personnel, is really thinking through how much you're putting the risk in the hands of your in this case, the frontline workers, right? Versus how much do you put in institutional protections on exfiltration of data and things like that? Because I think the reality is, particularly for people, if we're talking data breach, right? Like phishing, particularly in an environment that's high pressure and you're dealing with what you said, multiple hundreds of interactions a day, people will click that email if you tailor it right. It is extraordinarily hard to eliminate, even with training, that problem. And that does suggest that you can't just put it all on people, that part of this has to be, thinking ahead logistically, exactly how much responsibility does there need to be in the individual user, and how much can you save them from themselves without getting in the way of the job they need to do.
Yeah, I agree with that wholeheartedly. And I actually agree with Dr. Morwood as well. I think that is a huge challenge, but I also think that with a governance, an internal governance and risk and compliance kind of focus, there are ways to have certain software and I believe one of the gentlemen was talking about a software protocol. There are ways to have certain software that can actually have some of those controls inherently embedded in them, which kind of takes the human factor, interaction, having to recall all these things. But the fact that you have hundreds or multiple devices and they're mobile, all it does is create the complexity onto the simple solution, right? So looking at things more simplistically and how that can be rolled out and managed might behoove and be a very good exercise.
Grace, there's a couple of comments in the text. I've been following the text messages on the side that I think sort of tie together. And I'm generally not a big government advocate. I'm sort of a federalist. I think if you have a bunch of different experiments, you often get the best solution. But given I think healthcare is critical infrastructure for the country. And to Carmela's point, that there's so many institutions around the country that are facing similar problems, but just don't have the depth of resources to tackle them. There may be a role here. It's well and good to put in place the HIPAA legislation and say, we're going to find the bejesus out of all of you if you screw up. But maybe you could help us out a little bit, and the government could step in here and provide some standards to the vendors or provide some common solutions. That to me would seem to be a reasonable investment of government effort in this particular area because lives are at stake. It's no different than securing the electrical grid.
Absolutely, on the critical infrastructure. We have a couple vendors out there. Are you getting enough guidance, enough standardizations and things like that?
I'm sorry, guys, this is Scott with Clone. I would say, Grace, that I don't know that we have guidance per se. I mean, you have the regulations, which we're trying to help organizations meet. The issue we're having is there is no one standard, and there are different standards state to state as well, which also makes it somewhat tricky. So what might work for one organization may not work for another. And we work with a lot of healthcare organizations today. And what we need to do is we just need to sit down with them like we do with all of them. And we understand their operations, how they work, and what their infrastructure looks like. And then we put a plan together, how's the best to mitigate and try to automate not only the monitoring and the alerting, but the remediation as real time as possible. So eliminating people from the process is key. You aren't going to stop ransomware if you're waiting for a traditional SIM and for an alert to pop in and to see it. And then by the time you get a hold of somebody to try to stop it, it's too late. You need to stop it as it's occurring and as you detect it. So technology's got to be at a point to where it's smart enough to see it, it's smart enough to stop it real time, and also alert in order to prevent what happened in the UK. I mean, that's just the bottom line. I mean, otherwise it's just not going to happen. And one tool is not going to do it. It has to be, it's the old traditional defense in depth. If you look at one thing's not going to fix it. You just can't put, I'm going to put a agent on my machines and expect everything to be good, but I'm not doing anything on the network, or I'm not going to log, as you heard, people logging in out of machines left and right. I'm not going to track that and look for the behavior analytics and, hey, this is not normal for someone to do something like this, and alert and try to stop that and let people know. It's a whole defense in depth, and that's what we've done with our healthcare organizations. And, hopefully we continue to evolve that. And I think it's incumbent on the vendors to try to understand what's occurring real time and continue to advance the technology to make sure that they can attack or can stop and respond real time. If we can't do that, we're not going to win this war. It's as simple as that. That's just my opinion.
Yeah, I'm wondering how our technology is considering the trifecta. We have the usability from the healthcare professionals. We have the privacy, right, that may be at risk with all these devices across the Internet of Things. And technology putting security controls to be able to maybe track, every digital thermometer, anything with an IP, think about it, how broad this is.
Grace, this is Mike McEwen from BTB, and I'm kind of echoing a little bit about what Scott would say. I think the problem is information security kind of just touches all the way through an organization. So it requires some strategic thinking that kind of look at three components that we talk about with our customers: people, process, and technology. So there's some tools out there that can help make it happen, in terms of where it's at. But if they're not properly monitored, if you don't have a game plan in place for when they fire off, then that is problematic. And you'd love to see that centralized. The problem is that each, especially in healthcare, each organization has your special sauce, right? The way that you do what you need to do, and to try to get the government rallying around. I think it's a great idea, but to get the government to rally around people, process, and technology across the spectrum of healthcare, across all of the vendors that are doing business with, I think is a different challenge. But it's one that we believe you need outside experts like organizations like Scott's, mine, and others that are in this space. But you also need to build some internal beef and infrastructure that understands this stuff, so that you can be in a position to quickly respond to how the business is changing. So it's a tough challenge, and unfortunately, it's one where the budget's got to grow a little bit in the healthcare arena, so that your true, your knowledge workers, your true professionals that are saving lives and stuff like that, aren't encumbered, but are at least aware and know what to do if something goes sideways.
Thank you. Thank you. I think at the end of the day, we have to add that practical lessons learned from the field. Incorporate that, right? There has to be that middle ground. We can't get punished for everything, but I'm not the law here. So of course we can get fined. It's one of the consequences. Let's transition to Q&A. I want to open it up to the audience because we're reaching towards the end of the session. This has been very interesting. I had one email question I want to bring up. This one's a little broad, but how do we protect our individual data? How can we download our data in a private hard drive? And take, for example, in this case, the MRI files are huge. So now we're talking about huge data sets, and the healthcare professional needing to access, right, and be able to work. For one, I'm going to say, try to at least have hard drive encryption in case that device is lost, but that's just one solution. I'm not in the solutions business. What do you guys think?
I'll speak since I am in the solutions business. My preference would be is you don't download it and you leave it in a central location. It's easier to protect. The broader that the threat landscape becomes by replicating the data across multiple devices, the harder it is to secure. If you keep it in one place, like I think one of the panelists has said before, the transition to the cloud, people get concerned about the cloud, whether they're going to Google or Azure or AWS. The fact of the matter is it's in one place. It's much easier to secure in one place than it is if it's on this personal laptop and that personal hard drive or that personal hard drive. That becomes 10 times more difficult to protect and secure than it does if it stays in one place. So my suggestion would be is don't do it.
Thank you. Duncan, the benefits of keeping it in the cloud. What do you think from a legal perspective?
I mean, I think Scott just laid it out, right? Like, obviously there is a risk when you pull everything to one place that somebody's going to penetrate that target, whether it's Azure or AWS or what have you. But obviously it's going to take a whole lot more resources and effort to do so. So I think particularly from a small and medium enterprise standpoint, the logic is really to utilize that cloud. But again, recognizing this is all risk management and that we're never going to be able to eliminate the risk, right? Like the reality is, just like crime is a part of our everyday lives, as much as we've made efforts to try and get rid of it, cyber threats are going to be a regular part of our lives, which isn't to say we can't work it on from the defensive end. I also think there's work to be done on, the transnational end, right? Like, so much of this stuff is originating in countries that could be doing more to crack down on, you know, actors that are engaged in this sort of behavior, and how do we get to a point where, you know, cybercrime prosecutions and investigations are more effective, you know, particularly botnet takedowns and the like. And so, you know, I think it's, again, there's no silver bullet solution here. We certainly need to be doing more on the defensive side as potential victims to protect ourselves and think about how to allocate risk. But, you know, that's not at the expense of doing stuff more in terms of, you know, government to government, law enforcement to law enforcement, to try and figure out how do we, limit the pool of attackers, which unfortunately we're failing at right now, right? The cyber threat, you know, curve is this. Ransomwares are like this. You know, other cyber operations are kind of all on the rise right now.
The concept of keeping data in one place is an awesome risk mitigation or risk management factor that comes into play. And one thing that you know, I'm waiting for the cloud providers to, you know, jack up the costs for what they're doing. They've invested in getting us all sucked out there. That is an element of risk. But on the flip side, they are motivated to have a safe environment, and they've hired experts that are dealing with this stuff every single day, while traditional organizations are learning about these cyber threat factors. So I think it's an excellent, you know, when you think out loud about it, it's an excellent way to be able to go. And then as much as is humanly possible, keep the data in one spot. If, by the way, if you do feel you've got to do that download, encryption policies, some kind of, you know, data management policy, you should be, you know, dealing with for protecting, you know, basically your corporate assets.
Excellent. Excellent. Dr. Morwood, any last questions or issues you want to bring to the attention of our security and cyber and law experts?
Yeah, is there any way you can save me from having to change my password every 3 months? It drives me crazy. You know, and I'm sort of joking, but I'm not. It's the challenges of healthcare in the current environment. As things become more and more complex, the patients are sicker, the care pathways we're attempting to follow are more and more difficult. You know, that's all. It's things you can handle, and then you hit the barrier of the security. And I joke, but it is actually it's a challenge for us, trying to not only not make mistakes, but also to get things done in an efficient fashion while still jumping through all the hoops that we're given. And I do hate changing my password every 3 or 4 months.
Definitely, that's a great message for our students that need to consider privacy and usability in addition to security. As we are shaping the next set of rising stars, right? And we want to hear from the field and take that into the classroom. That is one of our goals in the program. Any last few questions? We're kind of running towards the end, so I want to give somebody a chance that hasn't been able to ask a question. And then Steve and I will head towards the closing. Any last comments from the panelists? Jump in.
I just have to say, I mean, it's not the international law side of me, but password managers are good. And so like, that's a tool that I think if you have a trusted password manager, I recommend. But I echo the idea. I don't know that it's actually all that much secure to change your password. I think better to have a diverse set of passwords, and then let you live with them. I don't know if anybody's, I also think we can stop with the numbers and symbols. Better yet, to come up with 4 random words, dog and San Francisco, Eiffel Tower, and like that alone, if you get out to 45 50 characters, is going to defend you against a brute force attack. So my sense is that the industry knows this, and you're starting to see the movement, but everything is obviously like 3 to 5 years behind. So we're still in 2-factor authentication world, even though everybody knows that 2-factor authentication itself is not perfectly secure. So I hope there's help for you on the healthcare password horizon, but it may take a little more time.
Carmelia and Michael, any closing comments?
I would have my only closing comment is to think about the maybe some of the students that are listening in is where all of us are trying to solve big problems in healthcare. One of the solutions that we're trying is how do you all patients very, very quickly are going to be 365 days a year. We'll have continuous stream of data monitoring them, right? So, Gordon is going to be faced with that reality. So I think automating a lot of the work that humans are doing creates that scale. And that's the opportunity also, I think, around security, right? You're taking a lot of the activities that, Gordon and his team are doing, and you're automating them. And if you put it, I think that in itself is an opportunity to improve security and then scale, and it brings better benefit to patients. So I would think of it from that perspective as well, the opportunity to innovate around that and from a security standpoint.
Yeah, I concur with everything that's stated in that regard. And I also think that, as you mentioned, Grace, with the students and what we're working on with them and ensuring that they understand some of these challenges, I think that's going to be really kind of a good bridge. And the more we work towards that and bringing industry standard and controls and that are out there into the educational and academia space, then therefore we're enriching and helping in that regard too for the next generation. So I definitely think that's going to be good.
Okay, did everyone got in their closing comments, Steve? I personally want to thank everybody. But Steve, got anything?
Agreed. I think we need to continue to communicate, innovate, and partner like we captured today. And I appreciate the interesting discussion and participation by our panelists. It was a great conversation, and appreciate everyone that attended today. Thank you.
Thank you, everybody.
All right. And if you guys want to connect with any of our participants, and the advisory board is in the website, but our panelists, are you guys in LinkedIn? How do we get a hold of you?
LinkedIn.
Yep.
Okay, excellent. And if there's any remaining questions, you're always welcome to reach out to me, and we'll try to reach out to the panelists and relay and keep the conversation going. I hope to see everybody in April the 15th, which is our next cyber lunch. I put the registration in the chat. Thank you to all the panelists. Thank you to all my advisory board and other security professionals that are chiming in, contributing to this discussion. I love it. I love the discussion, how it's happening, very, organic. And I want to keep this going. I want this to be one of the platforms to bridge academia and industry together in the diverse ways that they exist. So thank you so much. Have a great day.
Thank you.
Thanks, Grace.
Thanks, Grace.